AI has transformed healthcare this year, and we know this trend will continue in 2026. I have the following 6 predictions for 2026 on how AI and other solutions will continue to disrupt the traditional healthcare models. If you're a doctor or nurse practitioner and own your own clinic or medical practice, knowing this information can be the difference between growing your organization or having to shut its doors next year. Stay to the end, and I will give you 3 simple tactics as well that will get you ahead of the game of others. If you are new to this channel, my name is Theo Harvey, and I'm the CEO of SensorMed, the AI-powered remote care as a service platform for healthcare organizations. I consult with hundreds of medical professionals every year to guide them on best practices and implementing AI solutions and workflows in their current operations. I have worked with large organizations like Cisco Systems, AT&T, the Charles Barkley Organization, Blue Cross Blue Shield, and Google. And my mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. Prediction number 1, the AI backlash begins. AI is growing everywhere now, right? You see in every type of industry, specifically in healthcare. We know AI voice agents are all the rage. This is one of the fastest growing slices of healthcare, where the global healthcare voice agent revenue is growing roughly at 35 to 38% year over year for the next decade. This is several times faster than overall healthcare IT. AI scribes, which gives doctors the ability to chart their patient interactions without having to do the tedious writing down, is on the rise. AI automation and medical billing is also growing. And then finally, new models, for instance, clinical diagnosis and predictive models, as well as digital twins, which are virtual replicas of real-world people data that can sync together. This lets organizations monitor, stimulate, and optimize physical assets and really create a digital environment. Ultimately, the goal here with these digital twins is to create new drug discoveries. However, I am starting to hear stories about people in general rejecting anything AI related. One of the big things is AI psychosis, which is on the rise. This is an informal condition that appears to be triggered or worsened by heavy use of conversational AI tools, specifically chatbots. A typical person's delusions, paranoia, or loss of reality becomes centered around, amplified by interactions with these AI systems. For example, we've heard stories that AI is causing people to believe that AI is sentient, that it's divine, that it's spying on them, or giving them secret missions. This is really driving some of the latest tragic cases with teenagers, and it's really something we're fighting against now here as a society. Next, in healthcare specifically, privacy and surveillance worries are the dominant theme. There are studies that show that users with privacy cynicism have significantly more negative attitudes toward AI and other voice technologies and are less willing to share sensitive information. In fact, providers and patients raise concerns about where these AI data will be left, what happens in the case of a data breach, or uncertainty or where, how this data is stored and how it will be used, which can ultimately erode trust and slow adoption. I believe that a new trust barrier with AI will be needed and evolve over time as more and more patients and consumers push back on the tide of AI. For example, I believe that voice agents will start to identify themselves to patients as AI virtual agents, so people don't get confused that they're not talking to a real live human being. More and more companies will embrace this trust barrier, and I think that's the only way to kind of fight back against the tide of AI. So look for that prediction in 2026. Prediction 2. There will be another clearinghouse hack that will disrupt medical billing on a wide scale basis. If you don't remember, in 2024, Change Healthcare had a huge hack that was a ransomware attack by a black hat group that crippled U.S. claims and pharmacy transactions and exposed massive volumes of patient data. This forced United Healthcare's Change Healthcare to pay an alleged ransom of about $22 million. And this ultimately prompted regulators to call it one of the most consequential healthcare cyber attacks in U.S. history. So think about this. Currently, we're seeing AI automation being a huge factor in medical billing. Makes sense. Medical billing is something you do consistently. Every month is pretty static once you have process in place. And the goal was always to get cheaper and cheaper resources, first here in the United States and overseas. Why not use AI automation? Matter of fact, most recent surveys suggest that roughly 60-65% of healthcare organizations now use some form of AI automation in revenue cycle and medical billing, with hospitals leading adoption and smaller practices catching up. Market reports also show the AI and medical billing segment growing from under $5 billion in the US today to upwards of tens of billions over the next decade. This is great, but unfortunately, you're exposing yourself to more and more risks. When something's automated, it's almost as if you set it and forget it. So if an incident happens, for instance, in AI, you can do something called prompt injection, where you can change the original viewpoint of the AI model to disrupt everything and setting medical billing off whack. That can disrupt things tremendously, especially if there's an automation that was created specifically for a certain type of claim. So I can absolutely see something like that happen in 2026. Be prepared for that and prepare yourself going forward. Before I continue, I want to take a few moments to give you some insight what we found out recently. 84% of you watch our videos but are not subscribers yet. So if you can do us a big favor and take the time to subscribe, like, and comment below, as that will help the algorithm reach more people like you. Our goal is to build a healthcare community around technology and AI. And as it's rapidly changing, we all need to connect to help adjust to this new normal. So thank you for your time. Now back to the video. Prediction 3. Big healthcare rejects the big LLM companies. LLM stands for large language model. And those are the big companies like OpenAI, which produces ChatGPT, Gronk, owned by Elon Musk, Meta or Facebook, Google, and then Anthropic, which owns the Claude model. These large companies have built their own models, spent billions and billions of dollars and upwards probably trillions of dollars to build what they call these foundational models. But guess what? They need data to get better at their job. And one of the juiciest data sets out there is healthcare data. And so they're really trying to broker kind of relationships with healthcare models or healthcare organizations to know what's best to use. But I'm seeing more and more healthcare companies just being a little bit more cautious when partnering up with these foundational LLM companies and looking at their licensing agreements and being very careful. For example, I'm seeing healthcare organizations verify that the LLMs are not training their models with healthcare data specifically. If they partner with foundational model, these healthcare organizations are making sure that their data is not being used to train the model on their data set so that it shows up somewhere else when someone chats an ailment or something that was only specifically learned from Moffitt or from a large organization later. Moffitt Cancer Society or MD Anderson. This is something that's very careful. Also, that's security wise, PHI, patient health information, is huge, and you want to stay out of getting patient information out there. And so they really want to make sure in those licensing agreements between the foundational models and the healthcare organizations that they're airtight and protecting that data. Next, I'm seeing that healthcare organizations want to protect against hallucinations or drift from happening. So drift is basically moving away from the intended purpose of what that prompt, that chatbot was trying to get to when it came to that data set. They're looking at ways, making sure we protect that happening and what kind of governance can we put in place or in our model or in our licensing agreement. So if something happens, we'll do no harm to a patient. And last but not least, they want to guarantee there's always a human in the loop. This is a fancy term for making sure for any type of AI data gets released to the general public, it will be verified by a human. And so I think we're seeing more and more of that coming. So therefore, I predict that a lot of these large healthcare organizations will start to build their own LLMs using open source models so they can protect the IP and create their own specialized AI products. Prediction 4, new care models from the government will explode tech adoption in healthcare. Recently, the government announced 2 big programs that really got healthcare excited. The first was the MAHA Elevate program. Make America Healthy Again is a new CMS test program that gives money to clinics and care teams to try whole person and lifestyle medicine help. For instance, they want to help patients with food choices, exercise plans, sleep, stress, and avoiding harmful substances while also making positive social connections. Each MAHA Elevate project can get an upwards of $3 million over 3 years and be a grant, and it will select groups like primary care practices and health centers to run the programs to support this healthy habits alongside regular medical care for people with Medicare and other insurers. Next, the access model, or the advancing chronic care with effective scalable solutions. So this is for people who have regular Medicare, who have problems like high blood pressure, diabetes, long-lasting pain, or depression, and it encourages doctors and other providers to use things like providers, remote monitoring, and virtual care to help them every day, but not just at the office visits. The program will be voluntary and will last for 10 years starting in July 2026, will pay provider groups in a way that rewards better health results and not just more services. So think of it as like a trial period to see if the outcomes match. You'll probably have an upside incentive program. And there are tons of models like that currently in healthcare that's doing that. The best way to kind of look at this is like the access model will be like giving doctors cool technology tools and paying them more when the patients with long-term illnesses do better. While Elevate is like paying teams to run healthy living hubs. So basically helping people to eat, move, sleep, and relax better so they don't get sick. Both of those models will be launching here next year, and it's super excited to see this excitement around some new models and some new care plans to help patients from a vendor standpoint. Prediction 5, I believe we'll see another blockbuster AI healthcare investment. So if you didn't know, Open Evidence, which is a 3-year-old company and operates a ChatGPT-like product for doctors to find health information from medical journals and other trusted sources, is valued currently at $12 billion after it receives an investment of $250 million. So how does it win? And how does it justify that cost? Well, first of all, it has tens of thousands of medical professionals on the app, and the app is free. You can download it as a medical professional now. But they make their money by selling advertising space on this chatbot to pharmaceutical companies, similar to the way Google sells ads on the search engines. I absolutely believe that that's a proven model in healthcare and any type of model. Advertising is the way to go. So we'll probably see more investments in these areas where you can get more eyeballs. Can you sell advertising? Can you sell some type of services with access to such a valuable group like doctors? So more and more investments will coming in AI related type technology tool sets, just like Open Evidence. And finally, prediction 6, I believe a massive healthcare access crisis will evolve in 2026. Let me give you my reasoning behind this and why I believe this will happen. Basically, people will not have access to quality care like they've used to in the time. And I tell you, 3 different things are happening at the same time next year. First, we see the Affordable Care Act. What happened recently is that the enhanced ACA premium subsidies are not being renewed and will lapse at the end of 2025. So the average out-of-pocket premiums for a subsidized marketplace enrollees are projected to more than double, to rising to about 110, 150% in 2026. And this is on top of any underlying base rate hikes that typically happen in insurance models. So the best estimate suggests that roughly 7 to 7.5 million people will leave ACA marketplace coverage in 2026. And if the enhanced premium tax credits expire and premiums spike, with about 4.5 to 5 million of them becoming uninsured and the rest shifting to other types of coverages like Medicaid or going off exchange. This is huge. This is almost close to 5 million people that will no longer have access to care that they used to getting. And these are folks that weren't working, traditional 9 to 5 where their employer provided care. So where they're going to go and how they're going to get the care that they need. This is going to be driving force in that crisis of access because they can't pay for healthcare. How will they get the healthcare that they need? The second big headwind, big insurers are starting to cut their Medicare Advantage plans. So Medicare Advantage plans are basically commercial plans, like run by UnitedHealthcare, Humana, and others. They're basically their version of Medicare. What's happening now, the enrollment would dip by roughly 1 to 1.5 million people in 2026. Not because all those beneficiaries fully lose Medicare coverage, but because some will be forced to change or leave MA plans as insurers shrink or exit markets. So major carriers like UnitedHealthcare, Humana, Aetna, CVS, Elevance, and others are collectively exiting hundreds of counties in 2026, with the Kaufman Family Foundation, or KFF, and other trade analysis documenting a roughly 10% drop in total MA plan offerings and notable pullbacks in rural and some urban counties. My company works with several payers, and we understand that they start to pull back in their Medicare Advantage plans because of this. It's just becoming too cost prohibitive to treat patients who have Medicare. And because it's costly to treat older patients who have chronic conditions or other ailments. And so the best way is cut that cost and get out of that market totally. So that's going to totally dry up a lot of individuals looking for access that they were typically getting from their Medicare Advantage plans. And then last but not least, under the new bill that was announced earlier this year and will be launching officially in January 1st, federal Medicaid funding will reduce by roughly 15%. Which is about $1 trillion over the next 10 years. According to what the Congressional Budget Office is saying, That's going to be about 11 to 17 million people losing Medicaid and other public coverages over the next 10 years. This is huge. We're going to start slowly seeing that happen. So those three headwinds, Medicare Advantage, Medicaid, ACA subsidies, are going to just drive people not to get access to the care that they need. And so where are they going to go? And that's going to be a huge crisis in 2026. Look, all the doom and gloom and some positive in my predictions. As a medical professional, as a clinic owner, medical practice owner, you know what? These are things you got to prepare for. And so it is an opportunity, even in the midst of crisis. There's three ways you can deal with these new opportunities. You want to embrace, engage, and expand. So first, let's talk about embrace. You got to embrace the new models that are coming your way. And I definitely see three areas. You first have the government funding programs. For instance, we just talked about the Elevate Access programs. Go ahead and put your bid in to see if you can get them, or partner with someone who is bidding. This is a huge opportunity with millions of dollars at stake. Next, as the market is changing, I talked about that already, there is an opportunity, and it's unique and it's been a niche for a long time, and that's in the direct primary care space. If you didn't know, the new funding starting in January 1st will allow for employees to use their HSS accounts, health spending accounts, to fund concierge-like services. That's basically the ability to pay a monthly fee to get access to a doctor and call them and text them when you need help. Now you'll be able to use HSA to pay for that when previously you couldn't. So this is a huge opportunity. So make this opportunity to dip into that, experiment with that, and see how you can work with employee groups, direct to patients who are okay paying primary care physician to get direct access to them when they need help. That's a huge opportunity there. And then last but not least, you can embrace existing care models like remote care as a service programs like remote patient monitoring, chronic care management, principal care management, remote therapeutic monitoring. All these models exist so you can take advantage of them. If you haven't before, this is the perfect time to do it as you see your money and access and patient population panels shrink. In fact, CMS has increased the number of CPT codes for these new models. This is what my company does every day. So if you want to learn more, go to our website at www.sensormed.com. Walk you through exactly how we help organizations like yours take advantage of these codes today so you're not left out in the code. Next, you want to engage with AI technology. It's now or never. So you need to start to use your current workflows and understand how best enhance them with AI technology, because I think it will always be a battle with humans against other humans and how they're using their tools the best. AI is just a tool just like anything else. You need to start learning these tools and using them effectively so then your organization, your healthcare organization, your business will run properly and more importantly, win in this new normal. I recently did a video on the 5 levels of implementing AI in healthcare. So if you want to get into more details on how that works, go check out this video right here so you can get the latest and greatest. And then finally, you want to expand your learning. You have to do your own research. Attend those conferences, listen to experts on the subject via podcasts or YouTube videos. The information's out there. This is the time to expand that insight. So there you go. Those are my 6 predictions for healthcare in 2026 when it comes to technology and solutions. Some great ones, some doom and gloom, but you need to be prepared. Go check it out. If you like my predictions or you think I'm full of it, go ahead and put comments below. Love to hear from you.